April is HIV/AIDS Awareness Month. Here in San Diego County, nearly 20,000 residents are living with HIV/AIDS, and more than 1 in 10 of them don't even know they're infected. But even more troubling are reports from public health officials that 6,400 county residents are aware of their diagnosis and aren't getting the care that they need. Here to shed more light on this, Patrick Loza, Chief of the San Diego County HIV, STD and Hepatitis Branch. Good morning. Thanks for being with us.
Thank you so much for having me.
Okay, so that is the most troubling part, the last part of what I said, that there are so many residents living with this disease and they're not getting the care that they need even though they know they have it. Tell me a little bit about this problem.
Sure. So the larger context for this is that on March 1st, the Board of Supervisors unanimously adopted a Getting to Zero initiative for HIV. And one of the main recommendations of the Board of Supervisors was really to think about how can we re-engage these individuals in care. People aren't receiving care. Single mothers aren't receiving care because they need help with child care. Sometimes people have substance abuse issues or mental health problems that prevent them from being engaged in care. Poverty is often a huge problem for people. And
maybe even transportation and getting to their treatment, I would imagine.
And stigma and shame. People carry a lot of shame about having HIV, and it prevents them from actually seeking the care that they need.
But the county is really devoted now to making sure that each person gets their care despite any financial challenges. Is that right?
That is correct. Anybody with HIV who does not have the means to pay for their care can still receive very high-quality care and have access to all the treatments.
And as we know, that's not necessarily the case with other diseases and people suffering from other things, but that's because this is obviously a public health issue, right?
That is correct. When people are not in treatment, they can transmit HIV to others, and that continues the epidemic.
Tell us a little bit about what folks need to do in terms of getting tested and the problem of people not knowing they have the disease.
So it's really important that every adult in the United States be tested for HIV at least once in their lifetime. And if they have ongoing risk, multiple sexual partners, or injection drug use, they should be tested much more frequently, every 6 months to a year. And testing is absolutely available for free through healthcare providers or through the county's STD clinics.
And you really recommend that each person does that, even if you're not in that high-risk population that you just mentioned?
Absolutely. We identify lots of people with HIV who have no identifiable risk.
Okay. How can people get more information? I know they can go to our website at cw6sandiego.com, but also how do they reach you directly?
They can also go to www.stdsandiego.org, and they can find more information about HIV testing and HIV services and find my contact information. Okay,
such an important topic. We're going to have you back at 10 o'clock tonight to talk a little bit more about this. Patrick, thank you so much for being with us.
Thank you for having me.
Okay. All right, we'll come